at this time. And we are currently streaming to Facebook, YouTube, and Instagram. Soon to be adding one more platform to our live stream. We've just been growing. We've been streaming for almost 2 straight years now. So from last January 2021, every Thursday, 7 p.m., except if, their schedule changes, things like Thanksgiving. That is a week that we are going to be streaming the day before. More than likely, we'll stream on that Wednesday, or if I'm traveling or it's crazy, the time might be a little bit different. Hi, Cara. Thanks for joining. All right, so we're just having a little chat while we're warming up and allowing persons time to see that the stream is on and active. If you wish, you can hit the hearts down in the bottom right-hand corner. That will alert more people that we are on live this evening, as we usually are Thursday, 7 p.m. Eastern. All right, so if you do not already follow us on our social media platforms, make sure that you follow us on all of your favorites. I am on Clubhouse. Thanks for the hearts. I see those. I'm on Clubhouse. I'm on Instagram. Pardon me. I'm on Facebook. I am on, what else am I on? I'm on YouTube. Slowly creeping up with those subscribers, y'all. I see those subscribes. Thank you for those subscribes over on YouTube. I'm on Twitter. I'm on Pinterest. I'm on LinkedIn. Okay. Like I said, we got some more streaming capabilities coming soon. So also, if there's anyone that you think may be interested in our topic this evening, which is how lymphedema changes life after breast cancer, please do feel free to go ahead and tag them in the comments so that they can get this information as well. All right, but I'm going to go ahead and get ready to jump in at this time. So for those of you that may not be familiar with me, I am Dr. Felicia, physiotherapist, certified health coach, and I help women that are ready for change to get off the hamster wheel of fad dieting and to create true change in their lives by changing the way that they eat and the way that they move, so that they're eating healthy food that is nutritious for their bodies. It's good to and for their bodies. And also, they are able to move on a daily basis. So being very intentional about movement and eating healthy. All right, I am the proprietor of Adley Physiotherapy, which is over on Mackey Street here in sunny Nassau, Bahamas. I'm opposite the Commonwealth Bank Plaza. And I've been there for 5 years in that location, 1 year at another location. So I am 6 years into having a brick and mortar, 8 years into my journey as an entrepreneur. And I've helped hundreds of patients there over the years reach their physiotherapy goals. As a certified health coach, I am able to help so many more. I'm looking to help thousands more women to meet their health and wellness goals. Okay, because we want to be here, we want to have a good quality of life, we want to have our wits about us, we want to still be fabulous, right? Even as we age gracefully. So that is what it is all about here over on our platforms. And let's see, quick disclaimer, any information that we do discuss in this broadcast is not to be taken as medical advice. And we are here just to discuss some general information. I don't know the specifics of anybody's case. You will want to make sure that you clear any changes to your eating regimen or your exercise regimen with your primary care physician prior to making those changes. So I'm just giving some general information here tonight. And I do have one early question here about our different social media channels. And the question is, am I on TikTok? Yes, I am most definitely on TikTok as at I am Dr. Felicia. That is our handle here on Instagram, on TikTok, on Twitter, I believe on Pinterest also. And let's see, also on LinkedIn. We are Adley Physiotherapy on Facebook. Okay. But we are at I am Dr. Felicia on most of those other channels, including YouTube. Okay. So you always have some options to catch the stream and to catch any of our wonderful information that we put out about health and wellness on a weekly basis. So I'm most active on Instagram, in case you hadn't noticed, but looking to pick up the pace, pick up the pace on some of these other platforms as well. All right. So Ashley also says that it's great and that we can live stream on TikTok as well. We will be adding a fourth platform soon. So I'll check into that. I did not know that you could live stream on TikTok. I admit that I had fallen off of TikTok a tad. Okay. And literally just started posting over there again 2 weeks ago. So my days for posting over there, I'm trying to work on doing it on Fridays, getting it up on Friday evenings. But if I miss Friday, it'll be sometime over the weekend. I'll look into the streaming though, but I love it when these streaming platforms like allow you to stream several places at once. That's like the best setup and best situation for me. The only one that I stream on currently that StreamYard does not do is actually Instagram. So I have to always set up a different device for Instagram. That is a great tip though, Ashley J. And thank you for that. Yes. TikTok has been a little bit of an anomaly for me. I don't know. I have to like hit just the right note with TikTok, but I do see them like moving forward and progressing with what they are able to do as a platform or what they do and offer and provide, like the things with like what is it, going live with friends or however whatever it is, like posting with friends or something like that. So they got some things going on. I'm getting back into TikTok. So definitely y'all let me know if you'd like to see more of me over there. If anybody else here is into TikTok. Let's see. Good night to you also, Rain. Let's see. Okay. So Ashley says that their algorithm is much better. Okay. So that was my little I went off course just a tad there, but I did want to just kind of chat about those comments a little bit, chat with you all. And you all please do look out for Ashley J. Check her out. Ashley J. White. Check out her page here on Instagram. You just may see her sometime soon, right? So get acquainted with Ashley J. Check her out and see what she's all about over there. Ashley J is a coach as well, a different kind of coach from me. Okay, so if you want to find out what kind, then you're going to click on her name there. You're going to go in. Okay, check out her page, Ashley J. White. All right, fabulous. And good evening to you too, Betty. All right. That was my little round. I need a sip of water after that. Oh, you are welcome. All right. So let's go ahead and jump in here to our topic and our information. I won't be keeping you too long tonight. I just wanted to share a little bit more because it is Breast Cancer Awareness Month still. Breast Cancer Awareness Month is wrapping up. It is October 27th today, if you can even believe that. This entire year seems to have flown by. I won't even speak of this month, but the entire year is just like zip, 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 zip. It is gone. It's out of here. Okay. But I did want to have a little bit more to say on breast cancer because this is the month for it. You may or may not know that I am also a certified lymphedema therapist. So this is an area that I've been passionate about since my internships in graduate school. And it's one of those things that, I can't leave it alone. Okay, so let's jump in. How lymphedema changes life after breast cancer. So I like to start with some statistics. This stat is one that we've talked about before, but I need to say it again. And that is that 1 in 1,000 Americans have secondary lymphedema. So there's different types of lymphedema, and secondary is the one that persons usually would get after breast cancer, and it's due to some trauma that has taken place to the lymphatic system. And primary lymphedema, much less common. I believe it's about 1 in 100,000, and it occurs in persons that were born with some malformation of their lymphatic system. So it's congenital, something that they were born with, a part was missing. Okay, and we need all the parts of our lymphatic system to work together to have the proper lymphatic flow so that our bodies are working properly. Okay, we need the full system. Okay, so second statistic for you. Between 3.7 and 17% of women will experience lymphedema after a sentinel lymph node dissection. So that's a new stat for us here on these channels. I've never told you that one before. And so I need to tell you what sentinel lymph node dissection is. And I'll also tell you what a sentinel lymph node is. So the sentinel lymph node is the first lymph node to which cancer cells are most likely to spread from the primary tumor. Okay, so that's your sentinel lymph node. It's the first one. So sentinel, that's the first. It's the first one where the cancer would spread to. Now, your lymph nodes, they're found in concentration, here, like above the collarbone, underneath the neck here. You find them also in concentrations under your armpits and also in the groin area. We have hundreds of them naturally at birth. They're not able to regenerate or grow back, which is important. So when they get taken out, that is it. Okay. And usually the situations that they would be taken out is usually because if they are cancerous. Okay. So sentinel lymph node. Sentinel lymph node biopsy or dissection. So this is a procedure in which the sentinel lymph node is it's removed. Okay, so they look at it, they identify which one is the sentinel. Okay, they take it out. These are the surgical oncologists. Okay, and they take it out, they study it, examine it, okay, to see what's going on. Okay, and they're looking to see if there are indeed cancer cells present. Okay, then they use that information to devise a plan by which they will want to be saving the cancer survivor's life. Right? Okay, so this is kind of like plan of attack. It's not diagnostic because this is only a procedure that persons undergo after they have been diagnosed with cancer, but it's like almost like a hunting mission or like a fact-finding mission. Okay, so let's define also lymphedema. If you're not new here, you may have heard this before, but if you're new here, then this information could just be new to you. And if you have any cancer survivors in your life, they need this information. There is a startling amount of persons that have never heard of lymphedema, persons that have had cancer, had lymph nodes removed, they're at risk for lymphedema, and they don't even know what it is. They don't know what are the signs and symptoms to look out for. And every time someone comes to my office and they have lymphedema and they tell me that no one told them, I just want to eat my hair. Okay. I want to just eat my hair because I just feel like, my gosh, they didn't even know. And, yeah, like I said, passionate about it. Okay. So what is lymphedema? Lymphedema is the accumulation of protein-rich fluid in the tissues. Okay, so protein-rich fluid should not be hanging out in our tissues, okay? But what happens is in lymphedema, there's some part of the lymphatic system that's damaged and then is not able to properly perform its function, which is to remove that protein-rich fluid and put it back into the general circulation, do some filtration and all of that. Okay, so that's what's supposed to be happening when you have a healthy lymphatic system. Okay, and the lymphatic system is very important. I'm seeing definitely there's an uptick in persons even after having cosmetic surgery that are recommended, by their plastic surgeon to go ahead and make sure that they schedule to have their lymphatic drainages done. Okay, because they need that fluid not to be going all willy-nilly where it may, because that kind of defeat the purpose of that nice shape people trying to get, right? So you need this fluid to be basically kind of like pumped back out, encouraged to move through the lymphatic system and then be excreted. It is not an invasive process, and it's just going to be excreted as urine, okay, the extra fluid. So I always know when I've done a really good treatment, if they either have to go to the bathroom to urinate at the end of it, or if they can't even wait till the end and I have to go to the bathroom. I'd be like, oh yeah, I got them real good. All right. So that was just my little sidebar right there. Okay, so what you need now is, persons need to know this information. So please, please, please share it with them, okay? Very important to know what are the signs and symptoms to look for so that people are not progressing through these stages of lymphedema. Okay, there's 4 stages. And we don't want people to just be progressing through the stages, because the higher they get in the stages, the more complications there could be, the more negative effects. And basically, lymphedema is progressive if it's untreated. It is not going to just spontaneously reverse from stage 3 back down to stage 1 or stage 0 without treatment. So that's very important. Okay, so how could life possibly change after a lymphedema diagnosis? One way, number 1. After the intense phase in therapy, self-MLD becomes a daily routine. So that manual lymphatic drainage. So what persons would do if they are diagnosed with lymphedema by their physician, they should then receive a referral to go to get some lymphatic drainage, preferably from a lymphedema therapist. Okay, so that means there's some specialized training that has occurred. And so that person has a elevated amount of knowledge in the area, in the function of the lymphatic system. So then after that intense phase, which could last a few weeks, depends on what stage the person is in, how severe they are, how quickly they are able to have their limb. It could be their arm, their leg. If it was a head and neck cancer, it could even be the person's face, okay? That is swollen, because remember, like I said, you have lymph nodes here. So if those get taken out, then the swelling can come here. So then basically, when it starts to get towards the end of the intense phase of therapy treatment, the cancer survivor then needs to be well versed. And basically, at that point, the lymphedema therapist is now training the patient to care for themselves and this condition going forward, because this condition is not going away. And generally, how physiotherapists or physical therapists work, we foster independence. We are not trying to keep anybody in therapy every month for the rest of their lives. We are all about independence. So we're about teaching you the tools and teaching you the strategies, giving you the tools that you need so that you are able to self-manage. Okay? We get you to a point through that acute phase when you need us to hold your hand and say, there. And then we're kind of like, fly, little birdie, fly. Like, you go, be free. And we teach you what you need to know so that you can take care of yourself, okay? And so the idea is that they need to learn how to do a simplified version. Doesn't have to be, I always tell persons, because it seems daunting, there's a ton of steps, okay, in a full lymphatic drainage. And persons also ask, well, don't they just have this written down? And what I have to explain to them is that it's not the same procedure for everybody, because people all have a different medical history and they had a different approach to their cancer treatment. So, I have clients that one may come and I'm able to use their other arm and their other leg to divert the extra fluid to. But then someone else may come and they had like a blood clot in one of the legs, so I can't use that leg. Or someone might come and they have swelling on their trunk. Well, then the process is different. And this is also why it's important to go to somebody that has received some extra specialized training in the area. So, it matters. And don't just go for what's the cheapest price, or be like, oh, well, this person over here, they don't have any special training, but they say they could do it. Definitely, because there's always, in every situation, even when I see people for neck pain and back pain and shoulder pain, not every treatment is appropriate for every patient. And so that's why it's important to go to somebody that has, gone the extra mile to get this extra training, and they're, well versed, they're current on the information, And, there's someone who can take care of your health and make you better and not worse, because that can happen. All right, so we do have to get the person to the stage where they can handle a simple version, not as many steps as I would do in the clinic, but a simplified version of the lymphatic drainage, okay, so that they can handle this drainage on a daily basis. So that's one way that life changes. This has to be now added to the routine on a daily basis. And, that just kind of is what it is at this point. That's where we are scientifically. There's no cure for lymphedema, and there's not a pill you can take. There's not like a simple surgery you can get. There's just treatment. Okay, and this is a lifelong treatment that a person will have to be able to take care of themselves, right? So that is point number 1. Manual lymph drainage becomes a daily routine. The second way that life can change after lymphedema diagnosis is that there could be body image issues. Okay, so imagine you have a lot of persons that they need to be in a compression sleeve because of the lymphedema. Everybody needs to be in compression, right? I know if you actually have lymphedema, don't just go and buy a sleeve and put that on and feel like that is the treatment. That is not the treatment. You need to actually go and get full treatment, which has 4 parts. Okay. The bandaging is just one. So you have to, like, if you have a big arm, let's say person had breast cancer on the right, they have a big right arm. It's twice the size of their left. That person should not just go and buy an over-the-counter sleeve and put that on and be like, I think I'm good now. They need treatment, full treatment. Get the size of the limb down from twice the size of the left side using the lymph drainage and the other components. And then at the end of that acute section of the therapy, then they will be properly measured and fitted by the lymphedema therapist for a sleeve, because the ill-fitting sleeve also is pointless. Okay, but there's a body image issue because people are thinking, well, I'm wearing, everybody's gonna stare, like they're gonna wonder what's wrong with my arm. Or if it's a leg, it's not actually as bad because you could wear a long pants or a long dress and nobody would really see. But it's harder if it's the arm. We live in a hot climate here in the Bahamas. The sleeve is not exactly cool. Okay, so we have some compliance issues with patients and the sleeve, right? There are many reasons that they don't like to wear it. And I think one of them for a lot of people is that it just makes it so obvious. It makes them look like, I'm sick, I have a sickness, something is wrong with me. And no one really wants to feel that way or be viewed that way by others, by the public. So, there's a body image issue for sure. Now, even if you're not wearing a sleeve and your arm is like twice the size of the other one, may still draw some attention. Okay, and even for the cancer survivor, it may just alter the way that they feel about themselves. They've already gone through a cancer treatment. They may have had a mastectomy. That in and of itself is like something to wrap your mind around for a lot of women. And it's, because our identities for a lot of us are tied up in, this phallic symbol, the breast. So it's hard for a lot of people to let one or two of those go. Okay. So just imagine, that. And then on top of that, okay, yes, you have lymphedema as well now. It's like one whammy after the next for some. So it can be a body image issue, or even think about head and neck cancer. If your face is like swollen up, your face, your lip, it's like, that the face is the first thing that people see. So it's, people may have issues with wanting to come out in public, and there are unfortunately still some inconsiderate, insensitive, unkind people in the world. We I know nobody here is that type of person, so I know that you're all wonderful and fabulous and nice people. You're all nice to me. Okay, so it can be a lot. Okay, so we're looking at, yes, body image issues. That's a possibility. Point number 3, more cancer survivors think about what and how they eat. Okay. There is no lymphedema diet really. And some people will ask that. But some choose to go the plant based route. We were talking about the proper nutrition for breast cancer last week, how to fight breast cancer. And for a lot of persons, they do make the shift if maybe they didn't eat the best or have the best health habits prior to being diagnosed with cancer, then some of them may start to think about, hey, how can they make changes even about what they're putting on their skin, what they wash their hair with. They're thinking about everything now, like really reducing, the amount of chemicals that they come into contact in many different ways. So they're thinking about even the environmental factors, environmental wellness, right? So there is so much, that persons think about, and the way that a perspective will shift with a cancer diagnosis. Okay, so a lot of people will go plant-based. We talked about last week the Mediterranean diet being one that is highly encouraged for persons that have cancer, persons that want to lose weight, because of course, lowering your weight is good to help and lower your cancer risk as well as your risk of metabolic disease and, diabetes and also high blood pressure. Okay, so Mediterranean diet, we know we've talked about that so many times here on these outlets. Please do feel free to scan back under the video section in the Facebook. If you're on the Instagram, you'd have to scroll way, way back. Okay, but Facebook may be a little bit easier to navigate. You can look back for that video. And lots of good information in there. Gave you some examples of what are the types of foods that you could eat on a Mediterranean diet. Also, there is a free download if you are interested that you can get. And it's a 5-day Mediterranean meal plan that I'm offering to you for the free. And you can find it by going to bit.ly/Greek meal plan. Okay, got a couple of recipes in there for you that you can enjoy. Okay, so point number 4, you can persons have to monitor for cellulitis/infection. Okay, so it's one of the unfortunate side effects of that protein-rich fluid hanging out close to the skin. It doesn't belong there. Okay, so it's causing a few things. It's causing the diffusion distance, right? The distance between, where the tissues are and where the nutrients are just really far apart. So the nutrients are having a harder time getting to the tissues where they need to go. The waste is having a hard time getting out. And then, the nutrition can't get to the skin. Then you're having like skin breakdown. It's bad news. Okay, so cellulitis is like the skin is red, it's inflamed, could be associated with fever. It's just a lot. It's a lot going on. Okay, we know infection is not good. Usually a person will need to be placed on some antibiotics by their physician in order to clear that situation up. Okay, and it's something that should be dealt with right away, and definitely lymphatic drainage is not appropriate if a person has this. Okay, so it could also interfere with a patient that's in active treatment phase for lymphedema. And my last point this evening, point number 5, another way that their life could be affected with a lymphedema diagnosis after breast cancer is that a person has to wear bandages at night and compression garments during the day. So also this means that these bandages and garments, they don't last forever. Okay, they need to have some elasticity in order to be effective. So that then means that these need to be replaced. We recommend every 6 months that these garments and bandages be replaced. Okay, and for the garments, measurement by a trained professional is what's recommended. That's what's best. So you could always just return to your lymphedema therapist. You should be checking in with them every 6 months to get fresh measurements of your arm. Okay, so that you know if the swelling is still going down, staying the same, or we hope not, but increasing. Okay, and you get a good evaluation, like a check-in, check-in, check-up. Okay. And definitely when traveling, airline travel, when you're in the plane, even for persons that are cancer survivors that have had any removal of any part of their lymphatic system, I do recommend that they wear a sleeve just as a prophylactic measure while they are in the airplane because of the changes in cabin pressure. It's one of the things that can trigger lymphedema in the first place. So even if a person does not have lymphedema, they're a cancer survivor and they've had some lymph nodes removed, let's say from their armpit or their groin, then they should be taking that precaution. All right, so that is my presentation this evening. That is what I have for you tonight. I do thank you so much for joining me. A couple of quick announcements. Concierge PT service is available. That is basically home therapy service, home care for persons that cannot get out to the clinic. So if you are someone that needs that specialized personalized care at their home, then please do feel free to either DM or IM me, and I will make sure that we schedule a competent and caring therapist to come out to you or to your loved one at their home. One-on-one health coaching is available for those that need a little bit more help getting than what's offered in these live streams. I can only give you a few tips and strategies here every week. I'm happy to do so. You may find that you will definitely make some changes, but you may find that you can't really get a total transformation with just what you get here in this 20 to 30 minutes that we spend together once a week. And not everything works for everybody. Some people need a specific combination, right? Plus, there's just so much more that I could never tell you in 20 to 30 minutes. And also, please do stay tuned. We've got lots more special guests coming. We are not done yet for the year. We've got 2 months left in this year, if you can believe it. I'm super excited for Christmas this year for some reason. So I'm like, let's just get to the Christmas season. Let's get to the holidays, y'all. I'm super excited. And I'm excited to enjoy the holidays with all of you. We've still got more coming. We've got more special guests, more collaborations. Oh, let me know if you've been here for a while and you want me to bring back any of our special guests that we had early this year or last year. Let me know, because I'm about to start swinging back around to some of them that I think would be great to come back. But I want to hear from you all as well. Let me know if there was anybody that you particularly enjoyed and want to see again. Okay, so yes, we've got lots coming. Of course, I also have my course that I'm working on, my digital course that I'm working on that will be coming out. I will let you know the launch date when that is available. So I'm working on some things for you all so that you can continue to get more and more. So the digital course will be more than what you could get here in this 20 to 30 minutes. It will be more than what you could get even in one of the challenges that I've hosted previously. Look out for another challenge coming as well. So lots coming up, lots more in store, lots more guests, lots more collabs, lots more information, lots more fun, lots more community. All right, you all. So thank you so much for coming on tonight. And I hope to see you again here next week, 7 p.m. Eastern, right here on these same outlets, YouTube, Facebook, Instagram. Yeah, that's it for next week. But more coming soon, okay? With that, this is Dr. Felicia signing off, making the world healthier, one woman at a time. Good night.